The annual America's Health Rankings Health of Women and Children's report contains both good and bad news for Oklahoma. Infant mortality is dropping, but the death rate for young and middle-aged women has risen dramatically. Taylor Jackson has been going over the findings and joins us now with more details. Taylor.
Rich, Oklahoma ranks 47th in the 2023 Health of Women and Children's report, and that makes our state one of the least healthiest in the nation. Oklahoma's poor health rankings among women is part of the reason why nurse Elisa Joseph opened her organization, the Maternal Society.
Low-income countries are having the same exact maternal rates as Black women, specifically only Black women. So if you take the mortality and maternal rate for Asian women or white women here in America, you would be like, okay, it's because we have quality care. It's why our numbers are so much better, and their numbers are so low. I was so high. Their care is so low. But when you compare African American women numbers to the numbers in low-income countries, you'll see that they're comparable. They're the same.
The figures from the latest American Health Rankings report backs up Joseph's contention. Between 2020 and 2021, the mortality rate for women ages 20 to 44 in Oklahoma increased by 25%. Nationally, that number nearly doubled. Rankings are measured with 1 being the healthiest value and 50 with the least. Finding a healthcare provider might be a reason why Oklahoma's rankings for women's health took a hit, with providers for women 15 years old and older decreased by 10% between September 2020 to September of 2021. Oklahoma ranks 34th in maternal mortality and is considered a maternity care desert. Looking nationwide, the maternal mortality rate is higher among Indigenous and Black women. The Maternal Society offers prenatal care, community support, and in-home care.
We do lactation support, making sure baby is meeting the developmental milestones. So we weigh, and then we do pre and post feeding weights for moms for breastfeeding, just to kind of add some security around breastfeeding.
Joseph says there are many factors that lead to Black mothers dying during or after birth.
According to the CDC, as of April 2023, implicit biasness, structural racism, and poor quality of care are just the main ones that jumps out at me when I read and when you ask that question, because that's what they have concluded. They have done studies on top of studies. There have been studies in every state, because we are literally in a crisis.
Complications like hemorrhaging and infection can also lead to death, but Joseph says some of these are preventable.
Before you become in a state of life or death situation in maternal health, there are signs leading up to that. It didn't happen in 15, 20 minutes. It happened over a span of hours, even days, and your body starts to talk to you and you say, hey, I have an issue, or is this normal? And you're just overlooked, like, oh, you're just being dramatic, drama queen, or what you say really doesn't matter because you don't know. I know, I'm the provider.
On a positive note, more Oklahoma babies are making it past the 1-year mark. The American Health Ranking Report says infant mortality rate in Oklahoma has decreased 14% between 2016 and 2020. The pandemic could have something to do with the increased mortality rate as well. Dr. Ravi Jahir with United Healthcare says COVID is partially to blame for the nation's increased mortality rate.
But we've also seen an increase in drug deaths, in deaths due to firearms, and deaths due to injury, which would include accidents and things of that sort. That's been the biggest cause of increases in mortality in women.
Oklahoma ranks 37 for firearm deaths and 13 for drug-related deaths. On a national level, Alaskan Native and American Indian women see a higher death rate due to drugs, accidents, suicide, or homicide. Missing Murdered Indigenous Women President Carissa Hodge says historical trauma has played a role in the health of the Indigenous community.
So it goes all the way back to our removal, honestly. So one thing that makes you statistically more susceptible to these types of things, going missing, being human trafficked, being sexually assaulted, is removal. That's like the number one. And then number two is like health conditions such as like mental health and then drug abuse and things like that. So all of those things come into play. And when you have a specific ethnicity that has been removed from their home and has been put through boarding schools and all of those traumatic events, and they've never healed from them, it's just generational trauma.
Hodges' organization works to assist families with missing loved ones.
I partner with different organizations so that we can give them as much media attention as possible. So sometimes I'll get them on the news. I use Native Chalk Talk. Rachel Youngman is a wonderful resource, and any of my families that have new people, loved ones going missing, or have a murder case that has not been brought to justice, I use that outlet. And so that's one thing that we do. We are search and rescue trained. So we partner with PIs, and I have a lot of PIs that work pro bono.
Dr. Johar says the report is useful for state governments to determine what improvements should be made in their state. Rich.
Taylor, thank you very much.